What's up, guys? This is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. For those who are new to the channel, I am Dr. Webb, a 5th-year orthopedic surgery resident. In this video today, I'm going to be going over some medical memes and kind of giving my review about those memes. So I saw a couple videos about this. I thought it was pretty hilarious. So here we go. So the first one is headache. Normal person, I didn't sleep well. A medical student would probably think that they have an intracranial hematoma, which is pretty funny because in medical school you learn all these different disease processes and different diagnoses, and you think you have everything. So when you're in the neuro section, you get a headache and you're like, man, this could be, my symptoms are adding up to what I just learned. This could be an angioma or some type of epidural hematoma or something crazy like that. So everything that you kind of learn in medical school, if you're in cardiology section and you are learning about chest pain, and then all of a sudden you're having some anxiety, or if you're running too hard and you have some chest pain and you think you're having a myocardial infarction, which is a heart attack for those who are not aware of that term. So I thought this was pretty hilarious. All right, so the next one is, doctor, we couldn't save his hand in surgery, we're sorry. Woman, you said he was going to be all right. Doctor, well, his left hand is gone, so he's going to be all right. That's messed up, actually. That's really messed up. So, you know, when delivering bad news to patients in the hospital, it's always a delicate kind of balance of trying to say the right words. And that's one thing that they don't really teach us in medical school that well, is how to deliver bad news. But I thought this was pretty hilarious and pretty messed up at the same time, like I said. All right, so the next one. Guy, I broke my arm in 3 places. Doctor, well, don't go to those places. Well, I've had a lot of patients that come into the clinic or to our hospital and they say certain things like, I keep having this pain when I am going up and down stairs real fast, or I only have this pain in my leg when I do box jumps. Well, don't do it anymore. It's that simple. And then you won't have the pain anymore. All right, the next one. You claim you had no medical history. Your prescriptions for metoprolol, lithium, albuterol, metformin, hydrocodone, Crestor, Seroquel, Lipitor, and Coumadin determined that was a lie. That is so true. Man, I have patients all the time that come into the hospital. I'm trying to get their history. That's one component of when you examine a patient or you see a patient in the ER or in the hospital for a consult. Consult is when you're called by another service in the hospital, say the internal medicine doctors have a patient who has a hip fracture, and we go see that patient, and that's a consultation. And you have to document their history, their surgical history, what happened to them. There's different components of the examination that you have to take, listen to their hearts, listen to their lungs. You have to get their medication history. And there's a lot of times where a lot of patients, when you ask them and say, hey, what medical problems do you have? Oh, I don't have any. Huh. But your medication list here says that you're on all these medications. What do you mean you don't have any medical problems? Oh, yeah, I have little problems with my heart. Little problems with your heart? Well, you had a 3-vessel bypass surgery. You had a heart attack. You have some stents in your heart. So that is really hilarious that patients sometimes do this. And it may be a combination of they're just not medically adept to kind of what's going on. So I always try to educate my patients in terms of their history. I had a patient the other day who had something in his chart and he had no idea about it. I just told him and said, hey, you may want to go to your primary care physician and check on this, just to make sure that everything's accurate in your chart. So the next one, trying to leave my patient's room, but they keep on talking. Oh man, you see the look on the guy's face. He's just looking for someone to come in there and relieve him. I think in this day and age when physicians are obviously they're getting paid a lot less money than back in the day. So, and then hospitals are cutting down on visit time, so you only have a certain amount of time to see a patient. But the funniest patients are ones that when you ask him, say, hey, when did this hip pain start? Or when did your shoulder pain start? Well, I was in, 1942. Man, it's going to be a long encounter when they start that way. So, next one, patient tells you nothing is bothering them. Doctor walks in, patient is seen in severe pain. Oh my God, this happens so much. When you see a patient, usually in the hospital as residents, we see the patient beforehand, or even medical students, they see the patient before the resident, and then the resident goes in, and then the staff physician goes in. So by the time the patient actually sees the doctor, the attending doctor, there's been like 3 or 4 people who have went into the room and got their history. And each and every single time there's something new that comes up, or maybe the patient forgot that he forgot to mention it to the medical student. And the medical student may ask the patient, say, hey, how much pain were you having over the last week? And he told the medical student none. So this may change your treatment plan. So when the resident goes in, how much pain are you in? Oh man, it hurts so much, it hurts so bad. I'm in 12 out of 10 pain. Then you just look at the medical student like, what the hell? That's happened so many times. Patient will change their kind of history, or just remember some new things as the staff walks in. All right, so the next one, CrossFit, keeping orthopedics in business since 2000. That's pretty accurate. CrossFit, the motor, scooter bikes, all those things there. Patients come in with fractures, hip broken arms, broken legs all the time. That's one thing that keeps a lot of orthopedic surgeons in business. That's definitely true. So this one, Ortho in a cold blue. That is hilarious. Orthopods are the doctors in the hospital, orthopedic surgeons that, usually people who played a lot of sports, or supposedly play a lot of sports, or the jocks in college or whatever. I'm not sure if that's necessarily true or not. But this is pretty hilarious because when we don't get a lot of, in terms of manage a lot of patients' medical conditions unless they're primary on our service, which means that we're the only doctors in the hospital taking care of them, and we try to figure out how to manage patients' blood sugars. Like blood sugar, I don't know how to give a patient how much insulin to give them. I know how to fix a bone. I'll do that really well. But ortho at a cold blue, we just try to sit in the background and let the internal medicine or the cardiology doctors take care of the code. That's pretty hilarious. I need to brush up on my ACLS. Even though I just took ACLS, I need to brush up on it and make sure that I am up to speed on that. But in general, there's lots of doctors around the hospital that you can call when something goes wrong. And you always have some, for the most part, have some assistance around if you need it. Oh, so here it is right here. So me as a doctor, what seems to be the problem, Mary? It hurts when I do this. Then don't do that. Oh man, that is so true. I tell patients that all the time. Well, don't do that. Don't do a backflip if you're having back pain. It doesn't make any sense. All right, so 2 more. The face, that face, when you don't understand the question in an exam. Man, that's been so many times where, I'm just getting to a test and I feel prepared in medical school. I studied my butt off and get to the test, that first question on the exam, and I have no idea what they're trying to ask. It's crazy. I'm just looking at it. I'm looking around to make sure everybody else is on the same page. And when your medical students are looking around too, and everybody's looking at each other on the first question of the exam, and you have no idea what they're asking, it's about to be a long test. All right, that last one. So your friend's reaction when they're trying to go through your cell phone pictures in med school. Oh my God, this is so true. So If you look in my phone, I have a combination of pictures of me, things that I'm doing in my life, like traveling, different cards. I'm a card connoisseur. I have pictures of my family, but then kind of interspersed between those, there's pictures of nasty wounds in the ER or open fractures intermixed between these pictures. So when someone like my wife maybe goes through my phone trying to look at pictures that we took on our date last night, she may see a picture of a cadaver or a bone sticking out of the leg or something crazy like that, and just freaks her out. It's like the funniest thing ever just to watch her. And she'll ask her like, "Hey, can I see your phone?" I was like, "I'm not sure if you want to do that." And then all of a sudden she goes through it and just starts, "Oh my God, that is crazy." But yeah, so I just wanted to go through these medical memes and give my kind of thoughts and reviews on them. But if you guys like this video, comment in the box below. Maybe I'll do a episode number 2. But thank you for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. We'll see you next time.